I think it's really important to understand the history of lip lift surgery. It's highly relevant for what people are talking about today because, as we usually say, history repeats itself. And you'll see that here as I show you where lip lifts started and where they are today. And some of the old techniques are essentially just resurfacing in slightly different variations. The concept of a cosmetic lip lift was first described in 1970 by a Brazilian team by the names of Cardosa and Spurley. This was first described as a bullhorn-style lip lift, where the scar was placed at the base of the nose. But the first scientific paper was published in Australia in 1981. This too highlighted the bullhorn style of lift. Direct excision techniques followed, with scars being placed at the vermilion border, sometimes just for the upper lip and sometimes also advancing the lower lip to increase its volume as well. These surgeries of course generate scars right at the vermilion border, which can sometimes be more obvious, and at a minimum tend to blur and fade out the boundary of the vermilion, which can sometimes look more obvious that something was done. In the early 1990s, V to Y advancement surgeries were described, and this was meant to increase volume of the lip with incisions hidden on the inside of the lip. The first scarless suture suspension techniques were described in 2011. And that's making a fresh resurgence. And the endonasal lip lift, which is also sometimes considered scarless, was described in 2014, more than 10 years ago.